Hello, my name is Joy Lehman, and I'm excited to be here to discuss the needed addition of a clinical pharmacy specialist to our department at Rural Community Health. In my short time as pharmacy director, I've noted several opportunities for improvement. However, I feel with a reasonable investment from the hospital, we can decrease drug expenditure and greatly improve medication safety and compliance. I hope to achieve 4 goals with this proposal. First, we must come into compliance with the current rules of the Ohio Board of Pharmacy, Joint Commission, and Ohio Department of Health. Next, our goal will be to focus on patient safety, and concurrently, we will have major cost reduction initiatives as well as work on improving operational efficiency within our department. These goals will be accomplished in partnering with our medical and nursing colleagues, as well as optimization of the current pharmacy staff. We are proposing to hire a PGY2 residency-trained pharmacist in internal medicine. The salary and benefits package is estimated to be at $158,000 annually. The plan for recruitment will be to connect with regional health systems that currently offer this residency program and also advertise nationally through the American Society of Health Systems Pharmacy. I believe that compliance and safety is a team effort. As I stated before, it is our priority to come into compliance with the Ohio Board of Pharmacy and Joint Commission rules and procedures. I will work with the CNO and security to develop a zero-tolerance policy regarding lapses in medication security. Technicians will be required to review medication room security with every delivery and note any issues. Subsequently, I will submit monthly reports to the CNO, and together we can develop an action plan for any units not in full compliance. To ensure safety in our pediatric population, all pediatric compounds will require a double check from either a pharmacist, a tech, or a nurse depending on the shift. We will cease sending multi-dose vials for any pediatric order effective immediately. Following a 6-week onboarding process where the clinical pharmacist will staff all 3 shifts and round with various medical teams, the primary goal will be establishment of a medication formulary and the resumption of monthly P&T meetings. I'm engaging our Chief Medical Officer and CNO to solicit 3 participants each, and I will serve as facilitator for these meetings. We anticipate this project to take a full year to be complete. However, the development and adherence to a formulary has been shown to successfully decrease drug budgets, and I anticipate we should be able to decrease ours by 5% by the end of FY20. The addition of the formulary will also help improve medication safety. As the formulary develops with initial focus in the ICU and antimicrobials, we will be also developing medication use guidelines. The clinical pharmacist will engage in at least 2 medication use evaluations annually and assist our day shift pharmacists with each producing an MUE. As I stated before, we greatly value our partnership with nursing. The clinical pharmacist will engage with our CNO to help develop nursing education and patient education. All nurses will be required to inform patients or family members when a new medication is being initiated and inquire if they have any questions, and if needed, direct them to pharmacy and/or provide micromedics care notes. The pharmacist will initiate comprehensive medication reconciliation on their assigned rounding service and work with nursing to initiate MedRec in the emergency department. We would also like to pilot a technician MedRec program by training our technicians to perform MedRec in the ED on a rotating schedule for 2 hours on Mondays, Wednesdays, and Thursdays. You can see I have an aggressive timeline plan with specific goals at 1 month, 6 months, and 1 year. However, I believe in the success of this role and the goal that it will align our medical, nursing, and pharmacy staff. Through this plan, we can and will achieve significant cost reductions that will not only pay for the pharmacist, but also allow us to consider future investments. My goal is to return in 1 year with significant cost savings. This will allow us to consider investing in 1 or more of the critical areas listed. Opportunities that I have noted for possible future investments include IT infrastructure that will allow for computer order entry and barcode administration, investment in our sterile products area to become 797 compliant, which is also a mandate of the Board of Pharmacy, and we can consider further improving security and efficiency with broader use of automated dispensing cabinet technology. I will be reporting back to this committee at 6 months post-hire of our clinical pharmacist to share project, and we'll have a full financial and clinical review for you at 1 year post-hire. I thank you so much for your time, and I will be happy to entertain any questions or comments.